Spiritual emergency is a term that comes from the field of transpersonal psychology. Spiritual problem is a term that comes from psychiatry, specifically from the Diagnostic and Statistical Manual, which is published by the American Psychiatric Association. And the term spiritual competency comes from the field of psychology, where I have published several articles in journals of the American Psychological Association on this concept of spiritual competency. And a spiritual emergency is a crisis related to sudden spiritual emergence during which the process of growth and change becomes chaotic and overwhelming. In such episodes, individuals often suddenly and dramatically enter into new realms of mystical and spiritual experience. However, they may also become fearful and confused and have difficulty coping with their daily lives, jobs, and relationships. And that term was coined by Stan and Christina Groff. Examples include distressing experiences that involve loss or questioning of faith, problems associated with conversion to a new faith, or questioning of other spiritual values which may not necessarily be related to an organized church or religious institution. So this was considered to be a breakthrough for the Diagnostic and Statistical Manual to include this category, because it was the first time they even used the term spiritual in the DSM. And what it did was mean that everybody who was studying psychiatry, psychology, social work, psychiatric nursing had to learn about religious and spiritual problems because it was in the DSM. The DSM has been called the Bible of mental health because everybody in the field has to study it. We're talking about mystical experiences. I shared mine. Near-death experiences, which have often been misdiagnosed as a psychotic episode, when somebody then talks about seeing their dead relatives, seeing angels, and so on, which are part of near-death experiences. Also, psychedelic experiences that can go wrong. And once it was accepted into the Diagnostic and Statistical Manual, I also started to realize, sometimes people have religious or spiritual problems, but for many patients, their religious beliefs and practices and spiritual practices are actually sources of strength. And that the field of psychiatry and psychology, we've been ignoring the positive sides of religion. And that led me to then think that we as psychologists and other mental health professionals, we need to become more competent in all of the aspects of religion and spirituality, not just the problems, but also how for many patients, their religious and spiritual beliefs are actually sources of support for them. So after 20 years of working on spiritual emergencies, I started to work on developing competencies that every psychologist and psychiatrist and social worker needs to have in order to work with their clients.